Your cataract surgery worked. You know it did. For months, maybe over a year, you read things you had not been able to read in that years. You drove at night without gripping the steering wheel. You stopped thinking about your eyes at all. And now, quietly, without warning, the cloudiness is back. And the thought you are having right now, the one keeping you up, is the one I want to address before anything else. You are not imagining it. And no, the cataract has not come back. That is actually not possible. Themselves a year or two later wondering why no one prepared them for this moment. Today, I want to give you what your surgeon likely did not have time to give you. Not just a name for what is happening, but the full picture, the mechanism, the fix, and exactly what to do next. What we are going to go through today, what is actually happening inside your eye right now, why this is completely different from a cataract, the one simple procedure that resolves it permanently, a warning sign you must not ignore, and the exact words to say when you call your doctor's office. Stay with me. Let me show you what your eye looks like after cataract surgery, because nothing about what is happening to you makes sense without this picture. Before your surgery, your natural lens sat inside a structure called the capsular bag. Think of it as a very thin, transparent envelope, front wall and back wall, holding everything in place. During surgery, your surgeon opened the front wall of that bag, removed the clouded lens through that opening, and placed a clear artificial lens inside the bag. The back wall of the bag, the posterior capsule, was deliberately left intact. It is what holds your new lens in position and keeps the inside of your eye stable. That back wall is what has gone cloudy. The cataract is gone. Your artificial lens is perfectly clear. What has changed is that thin membrane just behind it, the posterior capsule, the structure your surgeon intentionally preserved. When that membrane loses its transparency, light passing through it scatters instead of focusing cleanly on your retina. The result is exactly what you are experiencing. Gradual fogginess, halos around headlights, the feeling that something has slipped backward when nothing has. The name for this is posterior capsule opacification, PCO, and it is not a failure of your surgery. It is the most common late complication of cataract surgery in the world. Now, here is what I want you to understand about the mechanism, because once you understand it, the fear dissolves. During your cataract surgery, your surgeon removed the clouded lens, but a small number of cells, called lens epithelial cells, remained attached to the inside of the capsular bag. These are not abnormal cells. They are not the result of anything going wrong. They are the cells that originally built your natural lens, and they are biologically programmed to do one thing: grow. In the months and years after surgery, those remaining cells slowly migrate from the edges of the bag toward the center of the back wall. As they move, they multiply and begin laying down their own protein. That protein is not perfectly transparent the way the original capsule was. It scatters light. It accumulates, and over a timeline that varies from 6 months to 5 years, depending on the individual, it accumulates enough to start affecting vision. Research now shows us just how common this is. A landmark study from the Royal College of Ophthalmologists, analyzing over 500,000 cataract surgeries, found PCO rates of nearly 20% at 3 years and 34% by 5 years after surgery. That is not a rare complication. That is 1 in 3 patients. And that distinction matters because it means this was not a surprise to your surgeon. It just was not explained to you. A real-world study published in Eye, analyzing over 20,000 eyes over 5 years, confirmed that the type of lens implanted during surgery influences how quickly PCO develops, but does not prevent it entirely across any lens type. And a 2018 review published in the Asia-Pacific Journal of Ophthalmology found that for the general population, and particularly for older patients, the overall safety profile of the YAG procedure is favorable. The evidence is consistent, and it points in one direction. This is it is a treatable, well-understood condition. This is not something you caused. It is not because of how you slept, or what you ate, or whether you used your eye drops correctly. It is the normal biology of cells doing what they are programmed to do in a place where they could not safely be fully removed. I know what most women tell me when they come in at this stage, and I want to correct 3 things directly because they are delaying care that you deserve to receive. The first is, the cataract came back. It did not. The clouded lens was removed. A different structure entirely has changed. You are not starting over. The second is, I need another surgery. You do not. There is no incision involved in the fix. No anesthesia, no recovery period, no time in a surgical suite. The procedure is done while you sit in a chair, and most women are surprised by how brief it is. The third, and this one I want you to hear carefully, is, if I wait, it might clear on its own. It will not. Posterior capsule opacification is a one-way process. The cells keep migrating. The protein keeps accumulating, and the vision keeps gradually fogging. Waiting does not reverse it. It simply allows the clouding to progress further before you receive the help that is waiting for you. Now, before I tell you exactly what that help looks like, I want to pause here and give you something practical. I want you to do a simple self-test right now because it will tell you whether PCO is the dominant issue in your current vision or whether something else is also happening. You will need something with high contrast across the room. A book title on a shelf, a clock on the wall, something with dark letters against a light background about 10 feet away. Stand in normal, indoor light. Cover one eye with your hand. Look at that object and notice how sharp it appears, from 1 to 10. Then switch hands, cover the other eye, and rate the same object again. If the eye that had surgery is now rating noticeably lower than the other eye, and that difference was not there in the early months after your procedure, that is a strong signal for posterior capsule opacification. If both eyes are equally affected, PCO may have developed in both, or something else may be contributing, and either way, the next step is the same. Call your ophthalmologist's office. Use these exact words. I would like to be evaluated for posterior capsule opacification. Using that phrase tells the person on the phone that you know what you are asking about, and it moves the conversation in the right direction immediately. Coming up, I want to tell you about the procedure that resolves this, how long it actually takes, and the one situation where I would tell you to wait. Do not skip this part. The treatment for posterior capsule opacification is called YAG laser capsulotomy. It has been the standard procedure for this condition for nearly 40 years. And in all my years of practice, I have never seen anything dissolve a woman's fear faster than walking her through exactly what happens, step by step. You arrive at your ophthalmologist's office. They put dilation drops in the affecting eye. You wait about 30 minutes for the pupil to open fully. You then sit at the laser, which looks similar to the microscope your doctor already uses at routine eye exams. You rest your chin on a rest. The doctor places a small lens on your eye to keep it steady and focused. There is no pain, only a gentle sense of pressure. The doctor then uses the laser to create a small, precise opening through the cloudy back wall of the capsular bag, directly behind your artificial lens. The opening is just large enough to allow light to pass cleanly through to your retina again. The bag stays in place, your artificial lens stays in place. Only for the cloudy portion is addressed. The laser portion takes 3 to 5 minutes. Total time in the office, including dilation and a brief pressure check afterward, is approximately 90 minutes. You walk out the same day. Most women notice meaningful improvement in clarity within hours. Full clarity typically follows within 1 to 2 days. And this is the part I want you to hold on to. Once the opening is made, it does not close. The cells cannot recloud it. The fix is permanent. I want to be honest with you about the risk because you deserve the full picture, not the watered-down version. After YAG laser capsulotomy, a small number of patients experience a temporary rise in eye pressure in the hours following the procedure. This is routine. Your ophthalmologist checks your pressure before you leave, and if it has risen, a drop is given on the spot. It resolves the same day. The more serious risk that sometimes comes up in conversation is retinal detachment. And I want to give you the actual numbers because I have seen that word cause more fear than the situation currents. A 2017 study published in the Journal of Cataract and Refractive Surgery following a large patient population after YAG capsulotomy found a cumulative rate of retinal detachment under 1% in the first 5 months, after which the rate returned to baseline. A separate 2021 study published in Acta Ophthalmologica following nearly 18,000 eyes with a mean patient age of 75 found no meaningful association between YAG capsulotomy and retinal detachment risk in older patients. Low risk, carefully monitored, well understood. That is what the evidence shows. The situation where I would tell you to wait is if you have active inflammation or macular swelling in the eye at the time of your procedure evaluation. Those need to be treated first. Your ophthalmologist will identify this at the appointment, which is one more reason that appointment is worth making. I want to say something directly to you because I have sat with enough women at this exact moment to know what the waiting feels like. When vision gradually worsens after a surgery that was supposed to fix the problem, the first instinct is rarely to call. It is to wonder if you are imagining it. To tell yourself it is probably just the aging process. To try a new glasses prescription. Or to wait until the next routine annual exam before saying anything. And I understand where that. The last thing any of us wants is to feel like we are overreacting or like we are asking too much. But posterior capsule opacification does not resolve on its own, and a routine annual exam is not the right timeline when a treatable condition is progressing every week. The three things I most often see delaying care are assuming the fogginess is just normal aging, waiting for the scheduled annual exam rather than calling with a specific concern, and seeking a new glasses prescription instead of an ophthalmology evaluation. None of those paths lead to the answer, and you deserve the answer. Let me tell you about a patient. I will call Dorothy, 69, a retired school librarian. Illustrative scenario, names and details are fictional. Dorothy she had attended every follow-up, she had used her drops, and for the first year, her vision was better than everything right.
It had been since her 50s. She read paperback novels again. She recognized faces across a room. Then, gradually, things changed. The morning light through the kitchen window looked softer than it used to. Driving at night had become something she was quietly avoiding. She had already asked her optometrist for a new glasses prescription, and the new glasses helped for about a week before the fog returned. What Dorothy did not know, and what no one had told her, is that a new glasses prescription cannot fix posterior capsule opacification. The problem is not the focus, it is the scatter of light passing through a membrane that has become cloudy. A stronger lens gets you past the eye chart. It does not address what is happening behind it. When Dorothy came in, the diagnosis at the slit lamp took less than 2 minutes. PCO in the right eye. We scheduled the YAG capsulotomy for the following week. She was back to reading her paperbacks 2 days later. She told me afterward that she had been quietly carrying the fear that her surgery had somehow failed for almost 6 months. The fix took 1 appointment. Here is what I would actually do if I were in your position right now. Step 1. Do the covered eye self-test I walked you through earlier. Note the difference in sharpness between your 2 eyes. That information is useful when you call. Step 2. Call your ophthalmologist's office, not your optometrist, and say these words. I would like to be evaluated for posterior capsule opacification. Write it down if that helps. That phrase ensures the conversation starts in the right place. Step 3. At the appointment, ask 3 questions. Is this PCO? Am I a candidate for YAG laser capsulotomy? And are there any factors specific to my eyes that I should know about before scheduling? Step 4. If the procedure is appropriate for you, schedule it. The procedure itself is brief. The recovery is essentially nothing, and the clarity returns quickly. Step 5. After the YAG, return to your life. There are no long-term restrictions. The fix is permanent. You have spent your whole life taking care of everyone else. This is 1 appointment that takes care of you. To bring this together, the cloudiness returning months or years after cataract surgery is not the cataract coming back. It is posterior capsule opacification, a clouding of the thin membrane behind your artificial lens, and it affects roughly 1 in 3 patients within 5 years of surgery. The fix is a brief laser procedure done in your ophthalmologist's office, with no incision, no recovery time, and a permanent result. The one thing I wish every woman watching this knew sooner is that the fear of something going wrong is almost always worse than the reality of what is actually happening. And the reality here is that what is happening to you has a name, a clear mechanism, a simple fix, and a same-day solution. If this helped you, please share it with a friend who had cataract surgery. She may be carrying the same quiet fear right now, and she does not have to be. I post new videos here every week on the health concerns that matter to women like you, the ones that deserve a real answer, not a 15-minute appointment. Subscribe so you do not miss them. And if you want to keep going today, the video on other vision changes after. I care about what happens to you. That is why I am here. 60 that are worth taking seriously is right there for you.